Assalamualaikum.
Waalaikumsalam warahmatullah.
Let's start. Okay, today we going to start our nearly last topic of central nervous system pharmacology, okay? Epilepsy. So, what happen inside epilepsy in the brain? The cortex. The cortex. Very strong stimulation all over cortex. All over cortex. Strong, sudden. Don't know what time. Yeah, just start. Sudden, sudden electrical, strong sudden electrical stimulation, okay, all over the cortex. Understand? So all over the cortex is the frontal lobe, the occipital lobe, the temporal lobe, okay. So all over the cortex, the frontal lobe, this part is the parietal lobe. Here we having sensory system. Here is sensory, and this one motor, okay. In mostly epilepsy, this part, motor cortex mostly involved, okay, motor cortex. So if you stimulate the motor cortex, from the motor cortex, if you remember our track, the pyramidal track system, corticospinal tract, from corticospinal tract directly going to muscles, yeah. So the strong stimulation of the motor cortex, the continuous excitation of muscle, what happens inside the muscle? Muscle continuously contract, relax, contract, relax, contract, relax, contract, relax, like this, okay? So continuous cycle start. It lead to, when continuous stimulation there, the muscle contract, relax, it lead to, it's your seizure, okay? It's your seizure. It's also known as tremors. It's also known as convulsions. Okay. So what the difference between seizure and epilepsy? What is the difference between seizure and epilepsy? Seizure, tremor, convulsion, nearly same thing. Nearly same thing. Okay. The seizure, there are many causes of seizure. There are many causes of seizure, okay. So seizure can be caused by, so what are the causes of seizure? So if you have problem inside the brain, okay, so you have the issue, like if you have electrolyte disturbance, you have sodium, potassium and calcium. Sodium, potassium and calcium, if the electrolyte disturbance there, okay. And another thing, magnesium also. So in case of hypocalcemia, hypokalemia, hypocalcemia, hypokalemia, they increase the threshold for neuron for excitation. So electrolyte imbalance is first thing. Understand? Electrolyte imbalance is the first thing. Another issue, if inside, if we have the cause for seizure, that's known as seizure. If, for example, the patient having tremor, yeah. So if we have the cause, if no cause, then epilepsy. Understand? Idiopathic seizure known as epilepsy. So now I think it's a better definition. Idiopathic. Idiopathic seizure is equal to epilepsy. Understand? idiopathic seizure. So if you correct the cause, if you treat the cause, you can control your seizure. But in case of epilepsy, can you treat epilepsy? No. Epilepsy, you just can control the symptom of epilepsy. It's very hard to treat the epilepsy completely. Okay, at any time, epilepsy can be started, seizure can be started. Understand? So the seizure electrolyte imbalance, it lead to seizure. If you have any tumor inside the brain, it can stimulate trigger. Okay. If they have issue like infection inside the brain, infection, infection inside the brain. Okay. After traumatic injury of the neuron, patient having trauma, traumatic injury of the brain, infection, tumor. Okay. If you have after infection, it can lead to brain abscess. Number five, brain abscess. Infection lead to brain abscess. And another infection, brain cyst. If you remember parasitology, neurocysticercosis, brain cyst. Okay, inside the brain we having cyst, neurocyst. It's a cestode is a parasite. Cestode is a parasite also affect the brain. It also can induce seizure. Okay, so brain cyst, brain abscess, brain tumor, brain trauma. Okay, brain infection. So infection maybe two category infection, viral and bacterial. Bacterial infection, especially meningitis, okay, or it may be direct TB infection. Viral infection, which virus most common cause infection of brain, like herpes simplex. Herpes simplex, okay. Herpes simplex, this virus is not causing meningitis, it's virus causing encephalitis. Encephalitis, okay. Encephalitis, encephalitis, viral, mostly viral, okay. And meningitis always, the most common cause is bacteria. Meningitis also can be bacterial, viral, and fungal, other category also, okay. So most common bacteria. Encephalitis is a brain tissue infection. Meningitis is a brain covering infection. It's a brain tissue. If infection here inside, it's known as encephalitis. If infection outside, infection here, outside, here we having what? Meninges, pyometer, arachnoid layer, okay? So meningitis. So meningitis can be viral, can be bacterial, can be fungal, okay? Encephalitis, hair infection, infection inside the brain known as encephalitis. Encephalitis. And infection outside here of the covering, it's known as meningitis. Understand? So these all the causes, like you have infection of the brain tissue, infection of the meninges, electrolyte imbalance, infection, brain tumor, trauma, brain abscess, brain cyst. Okay, so these all causes all lead to seizure. Understand? So seizure have some pathology inside the brain. Seizure have some pathology inside the brain. So if you have some pathology, okay, if seizure due to some pathology, that's your seizure. That's not epilepsy. Understand? That's not your epilepsy. Because epilepsy, if for example, one patient come to you having the problem to the patient having history of seizure, okay, the patient just complain, like tremor of upper limb, tremor of lower limb, like this, just okay. So after investigation, so what you do in investigation, you need to find out the cause. The first thing you need to do serum electrolytes, check the calcium, check potassium, check magnesium. Okay, so these are the common electrolytes causing seizure if there's a problem there. Okay, so try to find out infection history. No fever, no infection, no meningitis, no sign of meningitis, no sign of encephalitis. So if no infection, no serum electrolytes there, okay, you send for CT scan. Send for, you need to do CT scan. Yeah, CT scan or MRI. So after this, for infection, we need to do CBC. In CBC, you can find neutrophil high or lymphocyte high. Yeah. For infection, we also can need CSF for infection. CSF analysis. Understand? For infection, to find out infection. CBC done and CSF analysis done. Yeah. Okay. So for electrolytes, we need serum electrolytes. This investigation. Understand? Okay. Now any structural change, we need CT, MRI. CT, MRI will tell you the patient have tumor. Okay. The patient have any trauma related injury. The patient having inside the brain abscess, anything inside the brain, any structural abnormality. Done. So if nothing you found, everything normal. Serum electrolytes, normal. CBC, normal. CT scan, normal. CSF finding, normal. Nothing there. If nothing there, now what you can call this patient have what disease? Epilepsy. Understand? Because first you try to find out the cause of seizure. Clear? Cause of seizure. Okay, let me know what pH disorder lead to seizure. Alkalosis or acidosis? I
Alkalosis.
Yeah, good. I can give explain here the hydrogen and potassium. If you remember, always go in opposite direction. Okay. So if alkalosis outside, if alkalosis there, the hydrogen. So from the hydrogen from inside moving outside. In case of alkalosis, and this potassium enter to cell. When this potassium enter to cell, it can cause more depolarization. Okay, it can stimulate the neuron. Alkalosis increase stimulation of neuron, and acidosis depress neuron. Okay, acidosis depress neuron. So also another thing, alkalosis, pH disorder. Okay, for pH disorder, we need to find out of any history of pH disorder, like the patient have liver disease. Okay, patient have respiratory disease, patient have kidney disease. No finding of. So other test, RFT normal, LFT liver function, everything normal. If everything normal, no problem there. Yeah. So now it's mean the patient have still having seizure. First you try to search the cause. Okay. So what is the cause of seizure? What is the cause of seizure? For that purpose, you need to do what are the investigation there? Serum electrolyte for infection, CBC, CSF analysis, CT, MRI, LFT, RFT, everything done. If everything done, still no cause there, everything normal. So then you can call it that your patient come to you with seizure. Okay. So now you try to find out the cause. What is the cause of seizure? Understand? If no cause available, then you give the name. Every lab investigation, every radiological investigation normal. This patient having epilepsy. Understand? So what is the cause of epilepsy? No cause of epilepsy. Why epilepsy known as epilepsy? Because epilepsy has no cause. Understand? Epilepsy having no cause, just electrical stimulation. So now we classify epilepsy. Which area of the brain involved? Okay, listen here carefully. This is a full brain. Full brain, this is a frontal lobe, it's a parietal lobe, it's a temporal lobe. Okay. So if you stimulate, how you conscious? How you conscious? If you remember, reticular activating formation, yeah, reticular activating system, RAF. Okay. So it's excite your brain. Excite your brain. You are conscious now. If after the attack the patient lost consciousness or not lost consciousness, there are two categories. After the epilepsy, after the seizure attack, sometimes patient doesn't know where I am, what place, like this. The patient forget everything about the attack, about the seizure. Yeah. So it's mean that patient become after attack, the after seizure attack, patient become unconscious. Patient become unconscious. If patient still conscious, if patient still conscious and having after attack patient still conscious, So if patient is conscious, it's a partial epilepsy. Partial, I let explain two category. Partial epilepsy, sometime patient conscious and sometime patient not conscious. Sometime patient conscious and sometime patient unconscious. What the meaning of unconscious? After attack, patient doesn't know what happened to him or her. Yeah, nothing. No, just forget everything. Like unconscious, faint. Yeah. Clear? This unconsciousness. Nothing. No, no. Nothing. No about the surrounding. Loss of consciousness. The second category, the patient always unconscious. Always unconscious. That's your generalized. Generalized, understand? Generalized epilepsy. Okay, now come to partial one first. Partial one, if the patient conscious, is known as simple partial. Simple partial. If patient also unconscious and having partial seizure and having unconsciousness, so it's known as complex. Complex partial. Understand difference between simple simple partial and complex partial. What's the meaning of partial? Partial body part under seizure. Oh, what means partial body part? Maybe only upper limb, maybe only lower limb. Understand? Only upper limb, only lower limb, maybe not full body, not full body. Understand? Not just one part of body in seizure, just one part of body. Okay. For example, if you excite, if you remember the motor cortex, the motor cortex had different area from up to down. Yeah. So if you stimulate this upper part for leg, foot, lower part for face, mid part for limb like this. Okay, the full motor cortex. So if you excite full motor cortex, that time patient all body muscle. How many muscles? 610. Yeah. All body muscle under contraction and relaxation. Clear? So if you just excite the upper area, like just stimulation just in this area, upper part, then the only lower limb affected. If lower part, then only upper limb affected, like this. Okay. So if the stimulation only in the motor cortex, just specific area, if the specific area, that time, oh, it's known as partial seizure. It's known as partial epilepsy. Understand? It's known as partial epilepsy. So partial epilepsy, a bit local. Understand? Partial epilepsy a bit local. So most of time, this partial, if you, for example, you having tremor of upper limb, you having tremor of lower limb, you have some cause, mostly partial epilepsy, they having some, so that's why partial epilepsy is known as partial seizure. Partial seizure, not epilepsy. What's meaning of partial seizure? Partial seizure, if they have cause, they're just seizure. Okay, if they still no cause, like investigation, everything fine, MRI scan fine. Okay, no tumor, no brain abscess, nothing, no infection, no electrolyte imbalance. Okay, everything fine. If everything fine, the patient has still having partial seizure, that's your partial epilepsy. Understand what's the difference between seizure and epilepsy? So if you find out the cause, you have the cause for seizure, that time not call it epilepsy, must call seizure. Understand? So if you first, you must try to find out the cause. According to cause, have cause or not cause, this is the big difference between epilepsy and seizure. Done? So okay, now come back. Patient after the attack, just you clear the what's meaning of partial? Partial mean we just have one part of cortex is excited, not full. Only one part, okay? Only one part of motor, not full motor cortex. So it's a partial seizure. So partial seizure, upper limb affected, partial simple, and partial complex. After the attack, the person become unconscious after attack. That's a partial complex. If patient still conscious after the partial attack, just upper limb, just trembling upper limb, moving upper limb, yeah, and then again become unconscious, that's a partial complex. That's not partial simple. Okay, Why I am putting stress on these things? Because every seizure have separate drug. Okay, so therapy not same. Okay, therapy not same for all type of seizure. Understand? So partial, complex, and partial, simple partial and complex partial seizure. Simple partial and complex partial. There's a difference between simple partial and complex partial. Now again come back another thing. Partial. What's mean partial sensory? Just now we done upper limb moving. Yeah, that's known as partial motor. You moving your upper limb, you moving your lower limb. Like one part of body affected. Yeah, you're using skeletal muscles are moving and moving and moving and moving, having a tremor. Yeah, so that's your partial motor. Sometime what happens is known as partial simple, partial sensory. What means sensory? Come to cortex. Okay, come to cortex here. So if you stimulate temporal cortex, if you stimulate occipital cortex, if you stimulate parietal cortex, yeah. So parietal cortex, occipital cortex, temporal cortex, these cortex are sensory, these are not motor. So if electrical stimulation to temporal cortex mostly happen. Okay, now one patient come to you, listen carefully, okay? Very important differential. One patient come to you, what explain? Patient saying that the person having hallucination. What hallucination? Auditory. What is your first thinking about this? What do you think about this first? It's a very important sign for psychosis. This you know. Understand? It's a very important sign for psychosis. Listen here carefully. Hallucination, if just patient having hallucination, abnormal behavior, delusion, hallucination, we have typical things there, okay, in psychosis. The patient come to you having hallucination, just hallucination. Or it may be epilepsy. It may be psychosis. How you know? If psychosis due to more dopamine. This you know, yeah? So both pathology, if epilepsy just electrical stimulation related with sodium, related with calcium, related with glutamate. More excitation of neuron, okay? It's not related with neurotransmitter dopamine. Hallucination due to epilepsy have no concern with dopamine. Try to understand here, okay? Hallucination in epilepsy, if patient just complain having hallucination, how you know this hallucination due to epilepsy or this hallucination due to psychosis? Okay, I want to use in that person, I want to use antipsychotic. I gave chloropromazine, if you remember, first name, chloropromazine, yeah? Chloropromazine, try to give chloropromazine, okay? So that post of symptom, if you remember, for post of symptom, we give anti-dopamine, okay? Strongly high potency and low potency, the haloperidol, chlorpheniramine, trifluopheniramine, okay? So all that, bromethazine, etc. So if you give antipsychotic, can person give response to this antipsychotic if have epilepsy? Listen, if this hallucination due to epilepsy, we have concern with the sodium, and because more neuron stimulation, okay? That's not the problem with the dopamine. If the if the problem is dopamine, you give chloropromazine. You give chloropromazine. If hallucination is still there, that's your epilepsy. That's your epilepsy. It's like sensory seizure, okay? It's like sensory seizure. It's a problem with sensation. Sometimes this happen, okay? You must keep in mind this thing also. Not always go for motor. 90% problem with motor system in epilepsy, yeah? 90%. Sometimes patient just present to you with hallucination. Not skip this point from your mind, okay? Not just directly go for psychosis. You also can think about epilepsy, okay? You also can think about epilepsy. The patient not have any history of abnormal behavior, patient not have any history of delusion, the positive symptoms, okay? The positive symptoms of psychosis not there. What is epilepsy? already explained what happened in epilepsy. Sudden electrical stimulation. Okay, it have no timing. But how about psychosis? Psychosis, the psychotic disease, it take time to develop, slowly develop. Proper first abnormal behavior, showing some delusions, then come to hallucination. Yeah, patient have just sudden hallucination complaint. The only hallucination. Okay, why we mix with psychosis? Because hallucination is a typical finding for psychosis also. Yeah, it's not typically related with epilepsy, so that's why we confuse with the epilepsy and psychosis. So we can differentiate it easily. You can use antipsychotic or anti-epileptic. Okay, anti-epileptic, famous drug here, very old drug, carbamazepine. Not mix these two drugs. Chloropromazine. Okay, chloropromazine, promethazine, flufenazine. Okay, remember at the last, phenazine. Okay, so what is this? It's a carbamazepine. Understand? The carbamazepine. So, for example, patient come to you with hallucination. You want to differentiate it's a psychotic hallucination or epileptic hallucination. So you can use antipsychotic or anti-epileptic. So if the hallucination is controlled with anti-epileptic or antipsychotic, then you can confirm, oh, your sign is gone, hallucination is finished. Then you can confirm, oh, this is epilepsy or this is psychosis. Understand? So better to give chloropromazine. Why? Because hallucination is a main finding of psychosis. Main finding of psychosis. So start therapy for antipsychotic. The patient still having complaint of hallucination. It's mean that patient having. How you can differentiate clinically? How about the hallucination of psychosis persists for longer duration? Yeah. So what about the epilepsy? Hallucination just for short time, 1 day, 2 day, then again going, again finish, then again after 1 week have hallucination, again after 1 month have hallucination. How about the psychosis? Psychosis is a permanent problem of the dopamine. Dopamine permanently high in hippocampus, yeah, in limbic area. It lead to psychosis. So hallucinations stay for longer duration in case of psychosis. How about the epilepsy hallucination? Just come and go. Understand? Just for few minutes. Maybe next day sometime. Maybe next week sometime. Like this. It's not stay for long. It's not stay for long. Okay. Now you can differentiate hallucination of epilepsy and psychosis. It's a partial sensory problem. Understand? Partial sensory. Partial sensory. Partial motor, the mostly 90% cases we have problem with motor cortex. Motor cortex. Okay. Again, come back. Partial. Simple. Partial. Complex. Problem with just one limb. Done. Problem with just one limb, upper limb or lower limb. Understand? This person still conscious after attack. Understand? This person unconscious after attack. That's your partial, simple, and partial complex. So how about generalized? Partial, simple, partial, complex, the only one part of the brain is affected. Okay, one part. So if you have problem in one area, the mostly high chances for it may have some cause. It may have some local cause, may have some tumor, may have some brain abscess in specific area. Understand? Partial seizure, sometime, most of the time having some pathology. Having some pathology. Yeah, that's known as partial seizure, not epilepsy. Okay. Okay. How about the generalized epilepsy? Generalized epilepsy. Generalized epilepsy having a type 5 category there. 5 types, okay? Tonic, clonic, myoclonic, tonic-clonic, myoclonic, tonic-clonic, next, absence. Next, tonic-clonic, myoclonic, absence. Next, febrile convulsion. At last, status epilepticus. Status epilepticus. Okay. Tonic clonic. Tonicity. Clonicity. Tonic word for contraction. Hypertonia. Tonic.